Hey guys, hope everybody is doing well. I wanted to talk about COVID testing. With a disclaimer, I am not a doctor. I am a software developer, but I've been working in diagnostics for a very long time and have been involved in COVID testing since the past couple of months. So I thought the information that I have gathered might be useful, God forbid, if somebody in your family or your friends or you happen to catch the infection. So let's talk about the testing options available as of today. One is the swab sample. That is taken in order to gauge whether you have an ongoing COVID infection or not. There are two tests around the swab sample. One is the rapid antigen test. As the name suggests, it is a fast test, but the accuracy of the test is debatable. When one is positive on the rapid antigen test, the person is COVID positive. But in case the person is negative on the rapid antigen test for COVID, there is still a chance that the person might be COVID positive. As it has been observed, it is missing a lot of cases. The second test is the RT-PCR test, again done on the swab sample. It is one of the most accurate options available as of today. If you are positive on the RT-PCR test, you are COVID positive. But in case you are negative, there is still a slight chance that you still might be COVID positive. If somebody has symptoms, these symptoms are available all over the internet, so I'll just skip that part. And they are coming out negative on these tests and wants to be really sure of what is going inside their body, they should go for a CT scan of their chest. So let's talk about this CT scan of the chest. So CT scan is done in order to figure out of the chest, in order to figure out what is happening in your lungs. This disease is said to be causing viral pneumonia. So in case you are positive on either of the two swab samples that we talked about, or if you are negative and you really want and have symptoms and you really want to be sure, know what is happening inside your body, go for this test. You will know whether there is something going on in your lungs in terms of viral pneumonia or not via this test. In case you are COVID positive, you want to go for a couple of other blood tests as well. CBC, CRP, in order to gauge the infection inside your body. Then there is another test called the IL-6. It is done to understand if there is a cytokine storm in your body. The storm is basically if there is an infection in the body fights the infection. And in COVID, a cytokine storm happens, which sometimes harms the body itself. So the doctor needs to know what is happening inside your body, and IL-6 is one of the good options available to gauge this state. This disease is also said to be causing clotting. There are two blood tests available, D-dimer and ferritin. If the levels of either of the two are rising, you must talk to your doctor, because in that case he might want to give you some medication in order to prevent clotting. Okay, then there is a test called the COVID antibody test. That is a blood test. It does not talk about the state of the infection. It cannot tell you whether the infection is active or what is happening, when it happened, or things like that. The only thing that it tells you is that whether you have antibodies for COVID or not. So in case you want to know, if you have been asymptomatic and you did not know and you got the infection and you want to really know if you have antibodies for it, go for it. If you have had the infection in the past and want to know the extent of antibodies in your body, you can go for this test. So I really hope I did not bore you much and this information was helpful. Thank you guys. Stay healthy, stay safe out there. Bye.